Hi, sorry to bother you. I know we're busy. Just Sammy come in. So she's 40. She got brought in by your friend. The friend said that was your boyfriend.
No. Stop being nosy. Honestly.
She's 14, did you say?
Yeah, he's quite an older chap, but anyway, he's nowhere to be seen. But he's not in the department now. But apparently she'd fallen.
Hi, Sammy. You're right.
Yeah.
I'm really sorry, so you can't light that up in here, I'm afraid.
I'm just making it.
Okay. If you're going to have to do it, you're going to have to do it outside. So what's been going on, Sammy? What's brought you to hospital?
Has the
Somebody dropped me off outside.
Do you know who that person was?
Yeah, I do know.
Do you think anything else as well?
Okay. So what have you been doing tonight then? Fine.
Okay. Is there like no like drugs?
Do you want the real story or not?
I think the real story. I'm just going to have a
What are you
chat.
sitting down for?
Just so we're at the same level, we're going to have a little chat. So what's been going on is fine. Whatever you tell me won't leave these four walls. What's been going on, Sammy?
Yeah.
Depends on what you say, but a lot of stuff I won't tell. That's fine. What's been going on, Sammy?
I've just been having a few drinks from a bit.
I did ask about.
And how old? You're 14.
Might be, might not.
Okay. So you've been out with your mates, having a few drinks, and and that's it.
Okay.
And then I think I was dancing or something. Pole dancing, I think. Fell out, smashed my head.
You smashed it. Oh gosh. When did that happen, Sammy?
Just, I don't know, this afternoon, and I've got carrot between my teeth because I've been sick.
Sorry, Sammy.
Oh, I can't see that. But you've been sick, did you say?
Yeah.
And that's after you
My
got your
breath
head.
stinks.
That's okay,
Sound like
don't
I've been
worry.
stuck in a turd.
Don't worry.
Sorry, Sammy. Whilst you're talking.
It smells a bit like. Have you been drinking anything? It smells a bit.
I've just said I've been drinking.
You have?
I have, yeah.
Alright, okay.
Sorry, Sammy. Whilst you're talking, are we all right to get you hooked up some machines just so we can get some observations? Is that
If you
okay?
ask me nicely.
Was that okay? Was that nice enough?
Okay. No, Sammy, where'd you get that? Right. Put that down. Come on. We can't have a drink in here.
You are so bossy. My mum doesn't tell me off for having a
Put that
drink.
back. Put that down.
Right.
God's sake.
Okay.
Stop touching, don't you be touching me inappropriately.
He's just trying to help. We need to get some observations, Sammy.
Your friend said your mum was on holiday, eh?
She is, yeah.
Where's she gone? Somewhere nice?
Well, somewhere Manchester with a new fella. I've had 4 daddies this month already. Yeah.
My concern, Sammy, is that
Just pop that
you've
in
been
your phone.
drinking and you've hit your
Are
head.
you going to be my next daddy?
Well, I'm going to look after you while you're in here.
Okay. So you're my daddy in hospital.
Sammy, were you saying that you've thrown up? Sorry.
How times, yeah. I'm sure I've got the carrot between my teeth.
Oh, I hate when that happens.
Yeah, my breath stinks.
Can I ask, is it like you vomited like 3 times in a row?
Your temperature.
Or is it like you
I'll be
vomited...
sick in that. I don't want to wet willy.
Okay, it's just going to go in here.
It's just so we can check your temperature.
Okay.
Okay.
Is it like 3 times in a row, or has it been 3 separate times with a bit of time in between?
36.
Thank you.
I don't know, it was like, threw up, I got here, I threw up, and then I've just been sick again, if you want to have a look at it.
Yeah.
So your respirate rate's about 16.
Okay.
Where did you hit your head, Sammy?
Is that not obvious? Hey, I've just been doing selfies, and I've like been sending them like,
That's
there's
all right.
another one!
Yeah,
Sammy,
I think what she means is have you hit anywhere else?
Yeah. So do you mind if I have a look? Do you point to me if you've got any pain anywhere in your head? Point to me where, and let's have a little look.
Just, it's there.
Yeah, I can see
Smashed
here,
it.
but anywhere in the back as well.
Watch my hair clips.
That's all right. Do you mind if I have a little look? I'm just going to have a little look. There's any...
Watch my extensions.
I'll be very careful, Sam. Don't you worry.
Do it like this.
So you've been vomiting. Have you noticed any? You've got some headphones in. Are you listening to music or?
Yeah, I am.
Do you mind if I just pop them out?
Rocking.
Do you mind if you just pop them out quickly, just so I can have a look in your ears? I'll be very quick. Very good. Thank you.
Libby, she meets the protocol already.
Does she? That's fine. Okay, I was going to check the other one. We're just going to finish my examination. You do the protocol.
Yeah.
Yeah.
No,
That's
she
fine.
does.
Right, Simon. So
But you're looking at me. Look at all them eyes on there.
Oh, that's
I know.
That's cool.
They're lovely. Where did you get them from?
Just online.
Vintage. Everyone's shopping on Vintage.
Thank you. Do you know, right, so this is just a torch. I need to just shine it in your eyes just to see how your pupils are doing. You've done very well so far. just not too far. So just look through your head and I can have a little look.
Yeah.
We're almost done, Sammy. Come on.
Right here.
Yeah.
And then dangerous mechanism.
Stop laughing at me, doctor.
Come on. You're doing very well. You're doing very well. Look through your head. You can make a face, but I just need to check your pupils. You're doing
Yeah,
excellent.
exactly. I'm just thinking if it's
So, Sammy, you've hit your head.
We just need to double check this.
We're just a bit worried that because you've been vomiting. I know. I won't be long, but it's very important, Sammy, so you need to listen, okay? You vomited. What we need to rule out is that there's something going on, like a bleed in your head. So we need to do a scan. Okay?
I had a shit night's sleep last night.
Okay.
I'm gonna have a little sleep now.
Right. I'll be 2 seconds, Sammy. Don't move anywhere. I'm just going to check this.
But she's still talking. God.
She's got a risk factor, but it's whether she's had any loss of consciousness.
I can hear you. Stop talking about me.
Sorry.
Okay,
We're coming
So,
back.
Sammy, you know when you fell?
Oh, she's here again.
I know. I'm sorry about that. You know when you fell?
Yeah.
Did you black out at all, or did you lose
I
consciousness?
can't remember.
You don't. You don't.
I just
So we'll need to treat it as if she
Yeah.
has. Right, she's in.
I think we can ask a registrar just to make sure. But
When I spoke to the gentleman that you came in with,
Shalong.
okay?
That's what they call him. Shalong,
Okay,
mister.
right.
Yeah.
Well, whatever his name is,
Mhm.
okay, he said that you said you like did a bunch of twitching when you fell over, like that when you hit the ground and we tried to pick you up, you were like
Did he?
doing this. That's what he said.
Do you know, I was probably dancing. Dancing or something like that. I don't know.
Okay.
Oh, can I go to that body and shit now? Can I go to sleep?
You.
Just see if he's still. Hold on,
Yeah.
because I haven't seen.
Hey, no, he's gone. Leave Mr. Shalong out of it. Nothing to do with you.
Okay. I'll just see.
So,
You know the guy that came in?
where are your parents, Sammy?
No.
Told you. My mum's on a fifth
Yes.
boyfriend and my dad's off with a hooker somewhere.
Oh.
No idea.
Okay.
No idea.
It sounds like you're going through quite a lot.
Well, I've been
I
like
just-
since I was a
Is there anyone
kid.
like? Do you have any siblings?
No, thank God. They're all in care.
Okay.
Yeah.
initially,
It's just-
CT head.
I understand this
deal
is
with that sort of
quite.
thing.
We do the scan to rule out something serious like a bleed. It's just as if
Well,
there was
now I've
any.
got a bleed. It's there.
I know, but I meant
It's right
in the
there.
brain. So I was just wondering if there's anyone you'd like us to
I
talk
understand.
to.
No.
Any?
I tried.
No,
I've got
just
his
sleep.
mobile number for
Just sleep.
Yeah. Have we tried to call?
tried, but there's no response.
So
Fine.
we'll get that
Okay.
scan
We'll give
done,
another go
Sammy.
as well then.
But
Any other injuries? Have we done a top to toe squeeze?
we'll do a top to toe now. That's fine. So I think GCS is she's
I'll try them
moving her
again.
limbs
Try
freely.
them all again.
Pupils are pearl. She's spontaneously
My
opening her
pupils
eyes.
aren't pearl, they're hazel.
Fine. So have you hit anywhere else? I know you've hit your head, Sammy. Have you grazed anywhere else?
No, I don't think so.
Okay.
Have you seen the tattoo? Honestly, I went there, right, yeah. I'm only 14, but he thought I looked
Hello,
18.
my name's John.
okay.
Yeah,
I called
yeah.
you earlier.
I look
Just
well hard
from-
with that on.
from
Yeah,
the
well
agent
hard.
department.
Okay.
Yeah, got my nipple
Just
pierced
would
as
like
well,
to
that
talk to you
hurt.
about
okay.
my daughter who's presenting
Yeah.
here.
CT head.
Just
Something
Well,
else
if
needed,
you
is
can
that?
call me back as soon
Precious
as you
low,
can,
but-
I'd really
Okay.
appreciate
No, it's
it.
not low.
Just, she's fine.
So she doesn't. She says she doesn't hit anywhere.
She's
Ideally,
just
I'd do a
had
top
it
to
before.
toe, but
Yeah.
just because I
If you
don't.
could give us a...
You're not touching me.
That's okay.
No.
That's fine.
Fine. Not concerned about anything ABC.
So obviously there's some other stuff that we're concerned about.
Yeah, yeah.
We'll have a chat later
Afterwards.
about that after the scan.
Perfect.
Okay.
Right, so we'll get a CT head within
So we
the
need to
hour.
do a head scan, Sammy, and then we'll have a chat later about the results and
CT
then
head.
some other things. But I think you'll be with
We're
us
not
in the
worried about
meantime because we need to get this
Yeah,
sorted,
you need to do
okay?
that.
I was going to say, do I need to call then?
You're not going to tell my mum? Well, you can ring her, she won't answer.
I think,
Just need to...
it's...
Give them a ring, yeah. You just
Is
ring.
there any particular reason you don't want to tell your mum about this? Because...
She won't answer, she's not bothered. She's got her own
14.
life, I've got my life, that's it.
Gotcha.
Okay. I mean, ideally
Is it
we'd
CT?
want
Is that like you need
to
to call
call your
CT,
parents,
sorry?
but if you don't
Or
want
you
us
call
to,
CT?
that's fine. But and ideally we would like you to
CT.
talk to your parents, you know, because it's quite serious.
Yeah, yeah, perfect.
Like, you know, we can't...
Like switchboard. Hi, can you put me through to CT, please?
Okay, so where we
Thank you.
So I think...
Hello, CT. Hi, I'm Claire. I'm one of the F2s down in A&E. I've just got a patient here that needs an urgent CT head within the hour. I was just wondering if she could be brought round soon.
Well, can you tell me more about that, please?
Yeah, so she's a 14-year-old that's had a fall off a wall. She's a bit inebriated, so it's difficult getting a history. She did have someone here with her earlier who apparently reported that she had some twitching behaviour at the time of the injury. We can't find her in the department now, so we can't ask any further for the collateral.
So
she's also
consent for the CT?
Yes, my colleague has spoken to her and she's agreed to it.
Sorry, who did you get consent from?
We can't get hold of Mum, so we're just acting in her best interest, to be honest, and going with the scan. But she has agreed to it.
Oh, I think you need to speak to the PEDS team because they might speak
okay.
to the legal team because obviously you need to get parental consent for it to happen. So
Fine.
if you could get back to me.
Yeah, perfect.
Thank you.
Thanks.
Bye.
Bye.
What about things like, I know this sounds a bit daft, but what about things like pregnancy screening?
I was thinking we probably need to do both.
Hi, can you put me through to the PEDS reg, please?
Yeah, please hold.
Thank you.
Hello, PEDS Reg.
Hi, I'm Claire. I'm one of the doctors down in A&E. I've just got a patient here that I wanted to run past you because I wanted to get a CT head, but she's 14 and we don't have a parent present.
Oh, right. What do you need it for?
So she's had a fall. She's apparently fallen off of a wall. She's inebriated, so we're not really getting much of a history from her, but apparently there was possibly some seizure-like activity at the time. She's had 3 distinct episodes of vomiting. So we're just following the... No, she doesn't. Apparently the partner, or whoever he was, an older gentleman, was here earlier, but we can't find him in the department. We are still, looking out for him, basically.
Have you managed to get hold of the parents?
No, we've tried twice now and no answer. Apparently the mum is away in Manchester. I'm not quite sure who she's staying with currently. It's a bit unclear, but she's not really giving too much information away. I think we probably do need to have a CT head given the protocol.
Yeah, unfortunately we have to go through a process, so we'll need a best interest meeting. So that means us speaking to social services. Is she known to social services? Do you know?
Not that I'm aware of. My colleague's just speaking to her. Just give me 1 second whilst I ask.
Yeah.
Sorry?
No social services. No social services.
She says a lot of her siblings are in care, but I'll double.
Yeah. Sorry, we're just going to double check. 2 seconds.
You said your siblings in care, is that correct? Are you known to social services yourself, or do you...
I had a social worker. I called my auntie around that much.
Do we have a number for her or anything? Do we have a number for her? Might be quite useful. Yeah. Fine, yes, she is known to social services. I'm going to try and get a number off her at some point.
Okay.